from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about exciting advancements in the treatment of stroke patients, aiding in their recovery. This is the first in a three-part series about different advancements in rehabilitation. Our guest today is Dr. Ryan Hafner, a physiatrist and the medical director of inpatient rehabilitation at Sarasota Memorial. He also has an outpatient clinic with First Physicians Group. Dr. Hafner, thank you so much for being with us.
Thank you for having me.
What is the Vivistim implant?
So the Vivistim is actually a vagus nerve stimulator, which is a device that's actually been around for quite some time now. Vagus nerve stimulation has been used in the last 25 years for patients with treatment-refractory epilepsy as well as depression. But the Vivistim is actually the first device of its kind used for the purposes of stroke motor recovery or neuroplasticity, which is a fancy word for saying the ability to kind of bridge new gaps in the brain and to kind of build that recovery effort in the stroke process.
So because we're focusing on its use in stroke recovery today, why is this exciting for stroke patients?
Sure. So it's very exciting for stroke patients. First and foremost, it's probably the first advancement in this area of rehabilitation that we've seen in quite some time. For most patients who have a stroke, they find that over time, for a lot of patients, they find that their recovery kind of plateaus, is the best way to say it. They're working as hard as they can. They want to obviously get back to their normal, right? Walking their dog, taking care of themselves in the morning, feeding their kids, all those types of things that we all take for granted. And even with intensive inpatient rehabilitation, outpatient rehabilitation, maybe home health, all those types of things, people find that they still find some sort of plateau or level where they hit, where they're trying as hard as they can, but it just doesn't seem to be going any further. So for patients with strokes, they find that this therapy is the first treatment of its kind in a while that they can actually push the boundary of what they think is possible.
Sarasota Memorial is also a comprehensive stroke center and has the stroke recovery clinic. Can you talk a bit about this multidisciplinary team that we have here?
Yeah, so here at SMH, we have something very special, something that I would argue that is not seen anywhere else, at least on the Gulf Coast. This idea of an interdisciplinary clinic. I'm very happy to have a great relationship with all the therapists here at SMH, particularly in the Health Fit and the Rehab Pavilion is where we tend to staff most of our neurologic-based therapists. So within our clinic itself, our stroke recovery clinic, I see patients in the clinic myself to follow up with them long-term in terms of the big picture and what's going on, being able to triage them to certain specialists, but then also aid them and guide them during that rehabilitation process. So for patients who are in active therapy, if they come in to see me and they have active spasticity or tightness of their muscles, certain pain that's limiting their therapy, things like this Vivistim device, equipment and wheelchair prescriptions, all those types of things, we work hand in hand with the therapist to kind of make sure that that process is smooth and that they actually get the benefits that they want. So that idea of a physician-therapist relationship is very unique. And I know a lot of my therapists really appreciate that collaboration back and forth, and we tend to message each other all the time. And hey, what's going on with Mr. Johnson? How's he doing? Oh, he's having shoulder pain. Okay, I'll come in to see him and get an injection for him going. Or hey, this patient, Mrs. Smith, would actually be a great Vivistim candidate. All right, let's get the process going for that too. So between their team and my team, we actually have a great working relationship. So that's kind of the idea behind this comprehensive interdisciplinary stroke recovery clinic. It's very unique.
And actually backing it up even further than that, they come to the hospital when they've had that stroke or as they're having that stroke as the comprehensive stroke center. You also have relationships with the neurologists they're seeing. It starts as soon as they come to the hospital, right?
Exactly, yeah. So the idea especially for SMH is really improving that quality of care and the continuum of care, right? So they see fantastic neurologists here at SMH. Certainly there's been a ton of advances in the acute stroke category, whether it's a thrombectomy or use of chemical lysis for the, to kind of bust the clot, as they say. There's a lot of advancements in that arena. They get great neurologic-based care, at least to try to triage and try to take care of what they can in the first place, try to prevent that stroke from happening again. But where we come in is also trying to, this is kind of as your life is right now. How do we focus on making your quality of life now better? So that's where we kind of come in.
And how does having that team that starts from the moment they come into the hospital and then progresses after they get to go home and have this inpatient and then outpatient rehab. How does that positively impact the patients who do come here?
Sure. So we try to emphasize for patients that are part of the SMH culture that, if they're in this world with us, that again, we're going to provide that entire continuum of care, right? So from the get-go, when they're diagnosed with a stroke, when they first come into the ER, all the way through the acute care, into our inpatient rehabilitation unit plus outpatient, as you mentioned, right? The idea is not only is it great care, we have, fantastic credentials for all of our, treating therapists and physicians, but also, again, that continuum, that communication that you have, that back and forth, right? So the therapists in our acute inpatient rehabilitation unit will be able to see what they've been doing in the acute side, right? Be able to review the notes, and vice versa for when they go into outpatient and when they go into these other arenas. There's that you can build off the care that's been done, right? So we're not trying to reinvent the wheel here. People aren't scattered going to all these different providers in different places and nobody's talking to each other, right? It's that ability for everybody to come together and say, how can we best take care of this patient all under one roof?
So because you've already been seeing these patients in the stroke recovery clinic, how have you seen, now that Vivistem is here, it positively impact those patients? And why is it considered such a game changer by your team?
Sure. So I know our staff is incredibly excited about this technology. And firsthand, at least from my standpoint, I've had patients of my own in my clinic who I see for other reasons, right? Again, if it's spasticity or pain or kind of triaging other issues that they're dealing with, whether it's neurogenic bowel or bladder or things like that. There's a lot that goes on, right, in a post-stroke setting. But for the patients particularly involved with Vivistem, I've had one in particular just last week who called our clinic to let us know how great it was going with the Vivistem. Went out of their way, just out of the blue, wanted to let us know how much he appreciates having this technology and all the gains that he's been seeing. So, it's still fairly early on in the process of patients in the clinic and kind of what we're seeing with it. But so far, the results have been nothing short of outstanding. Patients that, again, have felt like they plateaued, right? Maybe had their stroke a few years ago, and for the first time are now tying their shoe with that affected hand, or grooming their pet, or cutting some food, things like that they weren't doing beforehand. And it's not to say that it's a full guarantee for everybody that's undergoing this therapy that they'll be able to achieve all the goals that they want to necessarily, but it's the first semblance of something beyond that plateau that people have felt in the past.
So what does the protocol look like? Let's back up. A patient has had a stroke. How do they go about getting evaluated to potentially get the Vivistem?
Sure. So it starts really with a screening, right? And physicians across the community can certainly be involved in this. I think, we really appreciate even primary care getting involved in this and getting educated on this device. But really, our neighborhood neurologists, as well as myself and others, can really kind of get involved in the process. If we know that this technology is available, I think it behooves all of us to be able to understand it and to be able to get people to the right spot that they need. So in that screening process, there are certain criteria that a patient has to fit right now. Based on the research study that was done initially to approve Vivistem as an FDA-approved device, it did require patients to be at least 6 months out from their stroke. It has to be a stroke of an ischemic nature, meaning it was a clotting stroke, not a bleeding stroke. They do have to have some active finger extension and thumb extension to be able to kind of somewhat grasp and somewhat release a little bit. They certainly have to be a surgical candidate. So even through all these screening visits, they still, at the end of the day, it needs to make sense and that it's medically responsible that they can have this surgery. And then typically the last one is that they don't have a history of what's called a vagotomy, which means a removal of that nerve. So in terms of the screening process, anybody can really get involved in the idea to screen them and get them into this spot. And then really it's up to the OT and the therapists that are treating to make sure, number one, that they have the deficits, the moderate to severe deficits that they need to kind of show that improvement, but also that they're a candidate. And then beyond that, it's, they get a surgical screening with the surgeon that's placing the device to make sure that they clear those criteria as well. And then beyond that, then it's really green light to get the process going. Once the device is implanted, right, and it's an outpatient procedure, right, same day, they get to go home the same day. They will come back 2 weeks later for a wound check, make sure everything's going okay. In that meantime, they're really asked to not do anything too strenuous, right? No heavy weightlifting or anything like that. Make sure that the wound heals well. And then once they get clearance from their surgeon about 2 weeks later, they will then start the process of 6 weeks of intense therapy, right? So that's really where they come in. If you read about Vivistim, they call it a paired VNS therapy, meaning, as I mentioned previously, the stimulators were used for depression and epilepsy. This is the first time where we're using a device, but the device itself is not going to make the gains. What matters is that you have the device plus this intensive therapy that you turn the device on during repetitive tasks. So those 6 weeks that follow, and it's a dedicated package, it's all part of the bundle of receiving your device, is that it comes with this paired therapy where it's going to be 3 times a week for 90 minutes per session, right? Very intensive therapy. And the whole idea behind what we're doing in the therapy session, it's very patient-centered. So the patient will say, these are the goals that I want to achieve, these are the activities I want to do, and it's high repetition, high volume, right? We're talking in a given session, probably 50 repetitions per task, and then maybe 5 or 6 tasks. So they're doing a few different activities up to 200 or 300 times per session. But the goal of that is bridging that connection and helping with that neuroplasticity and building on whatever task that they want, which is great. It's not an algorithm for everybody. It's, hey, Mrs. Johnson, what do you want to get better at? What do you want to do better? And then they go from there.
And before we talked about the continuum of care in the stroke recovery clinic, and how has already having that clinic and the conversations between the neurologists, the neurosurgeons, PT, OT, how has that helped in now the process of adding this Vivistim, of even the OT being able to go back to a neurologist and say, I think this is someone who should be screened? Has that really helped?
Yeah, no, definitely. And like I said, I think SMH does a wonderful job of bringing together all of us specialists, right? The neurologists, the neurosurgeons, the vascular surgeons, us as physiatrists and rehab doctors, kind of overseeing the entire process, plus the therapists, and having everybody under one roof has been really great. We actually have heard from several different companies, not just Vivistim, but others, that SMH truly has a unique, very rare interdisciplinary effect, right? That is not seen at many hospital systems. So we kind of live what we say.
So with this treatment, how does it differ for stroke patients who don't use the implant and say, just go to regular PT, OT, or your patients who maybe aren't candidates and just are able to continue follow-up with the recovery clinic?
Sure. So, in terms of the recovery clinic and the therapy, I do mention to people, and it's a very exciting therapy. That also comes with the caveat that, somebody might want this therapy and maybe they're not a candidate for that. And those are always tough discussions to have, certainly. I do know that in the future, certainly no guarantees, but I know that there is a desire to expand the indications and what fulfills the criteria and everything like that. So I'm hoping in the future, as this therapy gains steam, that more and more people will be able to participate in it. For now, if they're not a candidate for this type of therapy, certainly, as I mentioned, our therapy clinics are just nothing short of outstanding. So I certainly recommend any patient who has a stroke in the Sarasota or Bradenton area to strongly consider even coming to us just for their great neurologic-based therapy. We do have a lot of great outcomes even to begin with. So having Vivistim as another component to that therapy makes it even better. But certainly I tell people, even if we don't have you as part of the Vivistim protocol just yet, we're still going to work on everything we can, right? Which is standard of care with therapy, bracing, injections, medications, those types of things. So really where it comes in with the stroke recovery clinic, people at times, I kind of ask what's the role of different providers, especially for us as physiatrists, right? Which I know we've had a few podcasts on of explaining the specialty a little bit more. Usually what I tell people is to kind of explain it is that, think of mental health. Mental health is a very complex category, right, of different things to work through. And a lot of people will have, their psychologist or their therapist to do the talk therapy, but then they'll have their psychiatrist or their medical doctor who prescribes the antidepressants or things like that, right? So some people get better with just talk therapy alone. Some people get better with, a simple prescription of an antidepressant. It's kind of what we view for physical health for us is that, you have the physical therapists and the occupational therapists who are going to run through these Vivistim protocols, these high rep, high volume type issues, stretch you and walk you and those types of things, right? And then where we come in is we provide all the medical treatments for that, right? So again, the injections for spasticity, the injections for pain, treating kind of the entire medical component of this, and we really work hand in hand together really well.
So what about after these patients have completed that intensive protocol? Because the therapy doesn't necessarily end there, correct?
Sure. Yeah, so that's what's really great about this this therapy is during that 6-week process, therapists typically have the ability to control the stimulator. So they'll be on a laptop from, just across the bedside there. Patients will do the activity and then they'll kind of control when that stimulator is being turned on. But when the patients go home, the Vivistim company has mentioned that, they mention your gains are your gains. So for a lot of people after that 6-week protocol, they might say, hey, I feel good about where things are at. I don't feel like I need to work on anything else, which is great. But the nice thing is that this device has the ability, they give you a magnet for the device. So that way, when you do go home, patients have the ability to swipe the device with a magnet and turn it on for about a half hour, up to 8 times per day. So that'll stimulate the device every 10 seconds, and it allows the patient, when they go home, even after the protocol is finished, they might come home and say, hey, I actually want to work and get better at something that I do in the garage, or I want to work on this task or do something like this. So it gives patients the complete flexibility to self-direct their own rehabilitation at home, which is awesome. There's a lot of data. Again, this device is still kind of in its infancy in terms of collecting more and more data, but we have seen after 3 years post-protocol, a lot of patients that continue to improve because they keep working on other tasks, keep swiping their device, and keep the good times coming. And they want to keep getting better at everything. So it's fun to give patients that kind of power to be able to direct it afterwards. If they do have an insurance company that is willing to pay for more therapy beyond the 6-week protocol, we do have some patients that want to jump back into some PT after the 6 weeks of the formal protocol.
And being that it's a new tool, not all medical centers around the country are using it yet, and it does require specialized training as well. Why do you think it's so important that patients at a community hospital setting like Sarasota Memorial have access to this kind of care and the recovery clinic with this protocol?
Yeah, so I think this is the marriage of a wonderful new therapy that is groundbreaking, that we have yet to explore all the benefits, right? A lot of great things to come with this. I think it's the marriage of a new, very innovative device with an innovative center like Sarasota Memorial Hospital, right? So being able to collaborate, as we mentioned, with the therapists, with the physicians, and have this whole well-rounded approach. And it's not done in isolation, right? It's not somebody getting a Vivistim device implanted at some tertiary center, going somewhere random for therapy, and then it's all done in one silo. Like I said, the care is not scattered around. I have the therapists who are with patients in active Vivistim protocols right now that are giving me live updates on what's going on. Is there anything limiting that Vivistim protocol from being as good as it could be, right? Is there any ongoing shoulder pain that we're not taking care of? Is there any sort of spasticity or issues with tightness in the hand that we do need to take care of a little bit better to make that protocol even greater? So I think having that comprehensive care, again, it's a marriage of a fantastic institution with a fantastic therapy. And I think people are really starting to see that's a huge issue and a big thing that they're looking for nowadays.
Is there anything else you want to add? I know this is an exciting time and you're still watching these patients. Is there anything else you want to add before we wrap up?
Yeah, so especially for patients, I want to tell them, please don't lose hope, right? We're here for everybody. I tell my patients all the time, I'm not satisfied until you're satisfied, right? So, the world of neurorehabilitation is growing. There's a lot of new things coming on board. So I think the biggest thing is to make sure that, again, not losing hope, but also making sure you're following up with us and making sure that that continuum of care continues to develop and grow with you over time. Your needs will change over time, right? But having SMH as a resource for you to work on everything going on in your life post-stroke, I think that's the biggest thing is to make sure people know there are a lot of things that we can do for you to help you and make your quality of life as best as possible.
Dr. Hafner, thank you so much for joining us today and answering all these questions.
Thank you so much. I appreciate it.
As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.